Mic check, everyone. Thank you very much for joining us today. Um, my name is Festus Adedoyin. Can I just check that you can hear me clearly, please?
Yes, I can.
Great. Thank you very much for joining us at this December 2022 roundtable. It's a pleasure to be talking about digital health as an instrument, a vital instrument for improving health outcomes of people with Down syndrome in Africa. It's particularly a pleasure that the things we do at the African Center for Digital Health Policy Research extends beyond research papers, but translates into active policy making, particularly in underserved regions like Africa. And it's a pleasure for me to introduce our speaker. But before I do that, just a bit of housekeeping. This session is being recorded. It's also been live streamed on our social media channels. So you can invite your friends to join us, to listen to us. And if you wouldn't like to be recorded on our live stream, please feel free to turn off your videos. My name is Festus Adedoyin, and I'm the lead researcher and the founding fellow at the African Center for Digital Health Policy Research. Today, I'll be your moderator, so please settle in as we move on. The Korean Development Institute, School of Public Policy of Management, School of Public Policy and Management, launched the KDI School Alumni Working Partner Program, upon which we came together as alumni to found this research center to contribute our bits to SDG 3, which is about good health and well-being. And our focus is to systematically highlight different gaps within policymaking that relates to digital health, particularly in Africa, exploring opportunities within technology to enhance health outcomes and improve lives. It's my pleasure to welcome Ogochukwu. Ogochukwu and Ijezie is our presenter for today. Ogochukwu is a postgraduate researcher at the Department of Computing and Informatics at Bournemouth University in the United Kingdom. She is a researcher of great renown. She has published several papers talking about Down syndrome in highly ranked journals with a high impact factor. Ogochukwu will be speaking on digital health as a panacea for improving health outcomes of people with Down syndrome in Africa. Please follow with rapt attention. For those following us online on our social media channels, please feel free to drop in your questions. I will be happy to take these questions as we move on. A round of applause for Ogochukwu. Thank you very much. Ogochukwu, the floor is yours. Thank you.
Thank you very much, everyone. Thank you so much, Festus, for this opportunity. Thank you for the introduction as well. Like you rightly said, my name is Ogochukwu. I would want to say good evening to everyone, good afternoon, good morning from wherever you are viewing from. It's a great opportunity to join today's roundtable meeting, and I hope at the end of the day you're going to enjoy today's presentation. First of all, I would also want to thank God for this opportunity, and also thank Festus as well, Daniel, Joanne, Usman, Lovia, Jessica Miheyong, Bashir, Maria, and Kurede. Yeah, they are my fellow researchers, and I just want to thank them for this opportunity as well. Like Festus has rightly said, I'm a PhD student at the Department of Computing and Informatics, Bournemouth University, UK. And I'm in my final year, and interestingly, I'm also researching on Down syndrome. So I'm working on structural equation modeling of quality of life in adults with Down syndrome in Nigeria. So this is an opportunity for me to also share some experiences. So here's today's topic. So today's topic is basically on digital health as a panacea for improving health outcomes of people with Down syndrome in Africa. And here's the content for today's presentation. Introduction, existing gaps in the literature, digital health adopters in high-income countries, the challenges and benefits of digital health, the efforts that have been made by stockholders, the way forward, and also the summary. So Africa, basically, in Africa, we have 54 countries. It's a large continent, and we have over 1 billion people. However, we have the rate of energy, it's not accessible for all people in Africa. And at the moment, we have 42 countries that have employed the e-health strategy. That's also known as the electronic health strategy. So what is really digital health? There are so many definitions out there in the literature. So basically, I would say it's about applying information technology to improve health, which can also use artificial intelligence. You can also use machine learning to also improve health. And we have different areas where it can be, we have different areas. We have the M-Health, we have e-health. The M-Health is the mobile health, where you can access digital health via mobile devices like smartphones, tablets or iPads, and also electronic health. Then also have the telehealth, then telemedicine. Telemedicine is basically where patients have access to medical facilities online, not necessarily going to the hospital. They can interact with their physicians online. So we have, before I go into the digital health outcomes, the use for digital health to improve health outcomes for people with Down syndrome in Africa. There are so many definitions regarding health outcomes. Health outcomes is quite a broad concept. So we need to really understand what health outcomes are before profiling solutions to people with Down syndrome in Africa. So basically, I would say health outcomes is trying to know the outcome of results based on the intervention that has been done. For example, for adults with Down syndrome, they tend to be obese. Most of them are obese. So, but with the aid of digital health being implemented, they'll be able to know how to have healthy eating lifestyle. So the first definition here is from Lee and Leong. It says the health consequences brought about by treatment of health condition or as a result of an interaction with a healthcare system. Before I proceed, there is this myth by people thinking that people with Down syndrome can't do anything. They feel they are being addressed wrongly. Most people address people with Down syndrome as patients. Anybody can be a patient. So when you see a person with Down syndrome, don't say a patient with Down syndrome, and don't call them handicapped. Those are old terminologies that have been used, and don't try to infantilize them. Most people treat them like children. They feel they can't do anything on their own. They are very capable, provided that intervention is being provided, especially at an early stage in life. This is a second definition as well. And this is a third definition. So, like I rightly said, is just try to profile solutions for these people, making sure that their health is being put in check. So why Down syndrome? First of all, I would like to share a brief story why I'm interested in Down syndrome. Sometime during my first degree, that was my third year, one of our lecturers asked us to write a report on what we really want to apply statistics in, because I have a background in statistics and I also have a background in applied data analytics. So please don't really ask me how old I am, because it's been a long time when I did this. So when I did the research, I realized that most people with Down syndrome, they had similar features. And what really fascinated me was I wanted to understand, why do these people have similar features? And I noticed that the one of the risk factors for someone having a Down syndrome is maternal age. That's when a mother is 35 years of age and above, she has the tendency of giving birth to a child with Down syndrome. However, recent studies have shown that even those that are 20 years upwards also have the probability of having a child with Down syndrome. So, and there are different kinds of Down syndrome. We have the trisomy 21, it accounts for like 95% of cases. We have translocation, it accounts for 3%. For translocation, it tends to be hereditary, so, but it's at a minimal rate. Then we also have mosaic Down syndrome. So it accounts for 2%. In Africa, basically, Down syndrome has not really been explored. For example, in Nigeria, the last research that was done on the incidence was since 1982, and to date, no report has been done, no research has been done, and there's a need for action. And also, we don't have like a database. So when you're trying to profile solutions for those people, by implementing digital health to improve their health outcomes, we need databases to be set up. And if there are no databases, there's no way we can have like proper accounts of how these people can be supported. We'll not also know how many people that are not know the actual count, especially those that are in hard to reach areas, like those in remote places. Then also, people with Down syndrome, they tend to have the risk of having Alzheimer's disease, and Alzheimer's disease causes dementia. And in the general population, majority of them have the chances of having Alzheimer's disease. And research has also shown that they are prone to death because of this. So we need proper support in helping those people, and not just supporting them, but they also need to be included. You know, when you're dealing with humans, if you're trying to profile solution for a human being, you need to involve that person. It should be person-centered approach, not based on the developers trying to develop for them. They need to be involved. Research has found that most of the time they're not being involved in research. They're always trying to get proxy reports. Proxy reports in a sense that data is being collected from family members or caregivers. They are not being given the opportunity to air their views. They're not being given the opportunity to report how they want to be treated, how they want to be supported. So personally, I'm an advocate for people with Down syndrome. And anywhere you see someone with Down syndrome, please appreciate them. They can do anything. They can learn anything they want to learn. You just have to believe in them. And they shouldn't be infantilized. So concerning the existing gaps in the literature, before presenting this, I had to do a search. I had to search different databases because, you know, before profiling solution, like I mentioned earlier, we need data. We can't just profile any form of a solution without having any data available. So I searched 6 databases, and I realized that it was just one article that was found. However, that article was not basically for adults with, people with Down syndrome. It was just basically an app that's being used to deliver services for people, those that come to the hospital. They just deliver services for them. And the app also helps to track genetic causes. You know, Down syndrome is also a genetic condition. So the app is also used to track genetic conditions like past histories. But I won't really say it's exactly to support them with health outcomes. So there's so much gap in literature, and I would really encourage people to really harness the opportunity to try to support those people on how their health outcomes can be improved. So as of 2015, all countries in the United Nations, those that are under the United Nations, they adopted the 2030 agenda for sustainable development. However, in Africa, there is no information regarding that. So that's 7 years gap. And 2030 is, we have 8 years ahead of us to go, and we really need to start working, try to make sure that we have digital health solutions that could help improve the health outcomes for these people in Africa. So there are other countries that have started working on these areas. There are 4 countries like is shown here. The first one is from the United States. There's an app called Down Syndrome Clinic to you. It's used to make sure that the health of people with Down syndrome are being put in check. They always have up-to-date information regarding them. And based on the app, there were positive feedback from parents, from caregivers, saying that it's been very, very helpful. And it was launched in 2020. And also in the United Kingdom, an app called DS Active Health Swap App. DS means Down syndrome. So it was launched in 2019, and it was also used to help, it was designed to help people with Down syndrome to be able to maintain good lifestyle, because people with Down syndrome have the probability of being obese, being overweight. And so we need them to have a good, healthy lifestyle. And with this app, it was found to be helpful. Then in France, there's an app called My Project. It was used to develop, it was developed like a life plan for people with Down syndrome. And based on the feedback from caregivers and family members and people with Down syndrome themselves, it improved their general well-being and also tend to promote self-independence. You know, when you are being given the opportunity to explore, like an adult, when you're being given opportunity to explore some tools on how your well-being is going to be upgraded, of course, it tends to promote self-determination, because research has found that most people with Down syndrome, especially the adults, they crave for independence. They have been silenced. They have not been given the opportunity to report how their general well-being is. It's basically family reports. There's a systematic review that I conducted. Basically, I was trying to investigate what is the self-report and the proxy report on the quality of life of adults with Down syndrome. From the study, I realized that majority of reports were from parents or caregivers. The caregivers could be staff, could be teachers, but not from the adult themselves. And another one of the disparity between the report from the proxies and the self-reports were based on independence. So it still boils down to everybody that they want to be, they want to have rights to things in life. They want to have rights to good things in life. They want to have rights to explore opportunities around them. So we need to really give them the opportunity. And another intervention tool that was found was in South Korea. It's called Family Adapt Down Syndrome, that's DS. So they're trying to know how feasible the mobile health app would help promote the health of people with Down syndrome. And like I mentioned earlier, when you're trying to develop an app or digital health solution that would help improve health outcomes of people with Down syndrome, they need to be involved. You don't need to cut them out. They need to be there. They need to partake of the study, because they are the ones that know what they really need. And in that regard, you're also trying to give them the rights to live as well, because everyone in life wants a good life. So if you're not given the opportunity, it means you are being denied your rights to access to things. So it's a very good thing to look out for when trying to help them. Okay, so what I did was when the app that was being developed, the mobile health app that was being developed in the UK to help promote good health, like healthy lifestyle for people with Down syndrome. The app is available on App Store and Play Store. So I use an Android phone. So I downloaded the app just to play around and see the features of how it looks like. And this is how it looks like. So if you're using an Android phone or an iPhone, you can just you can just check for health swap, and you will see this how the app looks like. Then there are options. So if it's someone that has Down syndrome, they will select the first option. Or if you're a carer, for me, I selected a carer for someone because I would say, since I'm an advocate for people with Down syndrome, I'm also a carer, and I'm proud to be a carer. And you have to type in your name. It looks like this. Then, yeah, so this is how it looks like. And I found it user-friendly. So I would also encourage policymakers or healthcare professionals that are applying to that are going to support these people to try to look for design an app or a solution that would help those people, and it should also be user friendly. So what are the challenges and barriers? Over time, we've been hearing stories of how Africa has not really harnessed its opportunity. I would say it has become like a norm, but we have to change the narrative. It's time for us to act. No more reading and trying to research and research and research. We need to act. You know, without action, then all what you have been doing is kind of a fruitless effort. So one of the challenges and barriers are poor power supply. So for this digital health solution to be actualized and to run for a very long time, we need consistent power supply. Africa is blessed with so many resources, and we are yet to tap into the resources. And so this is an opportunity for us to really harness what we have been blessed with. And also another barrier is in terms of infrastructure. So things need to be put in check as well to make sure that things are functioning, and not just developing an app, but it has to run the test of time, not just developing an app that after like 2 years, it becomes obsolete or it's no longer functioning. So it has to be consistent, it has to be useful and tested. And also in the case of managing data, you know, personally, I love when data are being managed properly, because if they're not properly managed, there's no way you can be able to have information on how to profile solution. So we need to really consider ethical issues, data confidentiality and privacy, not just trying to disclose people's information, or maybe when someone tries, maybe like, or I would say maybe an adult or a child with Down syndrome provides information regarding how they want to be supported, then need to be disclosed. No, we need to really have the attitude of try to protect their image, try to protect their record as well, and also making sure that legal issues are being monitored, and also their rights are being upheld as well. Then the benefits regarding digital health solutions to improve the health outcomes, it's going to help them to it's going to really help people with Down syndrome to really live longer, because, for example, the life expectancy of people with Down syndrome in the 1940s, it was approximately 12 years. However, no research, the data was not basically for Africa. It was from high income countries. So this is where the gap is. So we need to have information to know if people with Down syndrome are living longer, or if they have, if there's a mortality rate. So with the aid of this digital health app or solutions, is going to give us proper record, and also with the help of digital health health solution, is going to also provide solutions for so many health issues, and also is going to also provide opportunities for people to those, especially those that are interested in healthcare, in the healthcare, going to provide so many solutions for them. And also it's going to also provide solutions for those that are interested in information technology, information and communications technology, sorry. Yeah, so it's going to provide so many opportunities for them as well. And it's also going to encourage more capacity building, having more workforce. So far, even though we have said so many things or highlighted the gaps in the literature, I would also want to commend some areas that has been done. However, they are not for Down syndrome, but some of these places, some of these countries have started adopting digital health. Like a place in Mali, they've used solar energy and telehealth to also provide solution in their primary health community settings. And also in Kenya, they've developed life-saving instruction for emergency called Life. So it teaches healthcare workers on how to manage medical emergencies. So it's a good one, and I must commend them for that. So we need more of this. So here we have a bar chart showing the applications of mHealth in different studies. So this study, this particular chart, it covers different African countries. It covers Ghana, it covers Ethiopia, it covers Nigeria, it covers Uganda. However, for the studies, the highest application for mHealth was in maternal and child health. Then the list was on logistics. Then also eye care as well. So this is where mHealth has also been applied. So we need more applications for people with Down syndrome. So way forward, like I rightly mentioned earlier, so before we comment on this journey to provide solutions, we need to make sure that these individuals have access to smartphones. During my data collection last year in Nigeria, I realized that from my reports from people with Down syndrome, because I've analyzed a phase of the data, from the outcome, I realized that majority of them reported that they want smartphones, they wanted phone. So that is also kind of pointing down towards independence. So we need to provide smartphones for those people to also help them if they're going to apply either the mobile health or the electronic health. They need access to smartphones, and not just smartphones, they also need access to data. You know, it's one thing to have a smartphone, it's another thing to also have consistent data. So we need data, and we would also need those that work in the telecommunications to make this possible for them so that they would have access to subsidized data plans. And before we proceed further to look out for how health and digital health could help improve the outcomes for people with Down syndrome, we need to perform scoping reviews. Scoping reviews mean trying to do like a broad search of studies what have been done. It could include maybe thesis, like PhD thesis or master's thesis done by people, or maybe articles from journals, or even though they are reviewed or not reviewed, you could also add them together. That's for scoping review, because we need to understand the areas that need to be explored. You know, before going into this journey, you need to understand what is out there in the literature. Like I mentioned earlier, health outcomes, the definition for health outcomes is a broad concept. So we need to understand where exactly do we need to focus on. Is it the area of the health, the oral health, or is it the area of their eyes? Because most of them also tend to have eye problems. Is it the area of the respiratory organs? Most of them also have respiratory issues. So is it the area of dementia? So there's so many areas that needs to be explored. So we can't just go in there to just start developing an app. We need to really be systematic. We need to make like a planned effort to make sure that these areas are being addressed. Then for systematic reviews here, systematic review is different from scoping reviews. Systematic reviews trying to be kind of structured. You're trying to address a particular solution, and if there are studies out there that have been done on the general health of people with Down syndrome, we also need to also assess those studies by using quality appraisal tools. There are so many tools out there. There is risk of bias tool. There is Strobe tool as well. So there's many of them. So you need to assess the quality of those studies. And like it's as the name implies, systematic review. So it has to be a systematic approach, and it must follow every steps involved. There are no shortcuts. It's quite systematic reviews are quite challenging, but they're interesting. At the end of the day, you will see the benefits of the job. So we need that. They also need to conduct Delphi studies. Delphi studies meaning that people, in the summaries, Delphi studies implies trying to have like a collaboration of people in different fields, trying to do like a research in addressing a situation. So in the Delphi study, it could imply maybe someone that in the area of health, or someone in the area of IT, or someone in the area of sociology. So it's kind of is a broad area. However, for this case, we need people with Down syndrome. They are very, very important. They are the reason why we are doing this. So we don't need to shut them out. We need to include them. We also need their family members or their carers. We also need healthcare professionals or experts. The experts here, maybe for those that have in the area of speech therapy, because some people with Down syndrome, they tend to have speech impediments. But however, with the aid of an intervention, it can be minimized. I would want to chip in a story here. During my data collection in Nigeria last year, I realized something that was really fascinating. I would say when I went to the Down Syndrome Foundation in Lagos, I realized that before one of the teachers taught the students, he had like a music session. And after the session, after the session, he taught the students. Then after that, I asked him, why did you have like a music session before teaching them? Then he said that most of the time they tend to be distracted in the class, but with the aid of music, it tends to stimulate their brain cells. So that's an interesting finding. So music helps them to stimulate their brain cells. And I also realized that when I also went to another center in Abuja, the teacher also did the same thing. And I also noticed that based on the report that I got from the adults themselves, because my study was basically focused on the adults themselves, then their caregivers. But I noticed that from their reports, they mentioned that they love music, they want to be musicians. And I've worked with 2 people with Down syndrome here in the UK, and they display the same thing. They love music. So music is a kind of therapy that would help stimulate their brain cells, but you can't just do that without testing it. So it needs to be like a proper research needs to be done, like randomized control trials. So those will have like an experimental group and a control group to check if truly music is a therapy. So this can also be implemented when designing a digital health solution. Okay, so that it will help them to meet their needs. So another way forward, there are lots of way forward. It's quite interesting. I've mentioned the randomized control trials. Then also when when you're dealing with people with Down syndrome, not just Down syndrome now, generally with humans, you need consent. Don't assume they've given you permission to collect data regarding them. They need to give you consent before you proceed. And for people with Down syndrome, you can design easy to read versions for them using pictures. With that, to be able to understand what you're really talking about, to seek for consent, and also seek for consent from their caregivers. So when I'm referring to people with Down syndrome, it cuts across both children, adolescents, and adults. So for children that can't provide consent for themselves, they would either their caregivers or their family members to provide consent on their behalf. However, they need to be there as well. They need to be explained. They need to be explained to like what the research is all about. So they are the main focus. Then also when building digital health systems, we need to be transparent, and it needs to be replicated. Sorry, and we need security as well, because without this principles, then there's no way we can build a digital health system that is functional. So because it has to do with technology, and technology requires precision, it requires accuracy. So we need to make sure that everything is on point to help those people. Then also trying to set up realistic deadlines before trying to help people with Down syndrome. We need to set up realistic timelines for each project. So if you're trying to focus on a particular project, we need to make sure that we can achieve that within a timeline before doing other things. So making sure that things are being put in place and making sure that we achieve the desired goals for these people. So in summary, Down syndrome, the World Down Syndrome Day is being celebrated 21st of March every single year. So this year has come and is almost coming to an end. By next year, we need to make sure that things are being put in place to help these people. And it needs to be put in place following the Global Health Organization's plan for 2020 to 2025. Hopefully, we need to make sure that this is being put in place so that we will not be left behind. Because without achieving this, it means that Africa as a continent is being left behind. So we need to make sure that we achieve this and not just going out there just to research only or writing papers only. We need to act and act now. Instead, we will just end up abandoning the project. So here are my references. Thank you for listening. So in conclusion, if you have anyone with Down syndrome or a friend, or if you see anyone in your community with Down syndrome, please try to treat them with respect. Don't infantilize them. They have every right to good things in life, just as you and I. They have every right. So, and also tell them that we are interested to make sure that their health outcomes are being improved. Thank you very much.
Thank you very much, Ogochukwu. That was a very insightful presentation, particularly how to see that not much has been done so far in African countries to manage the health of people who live with Down syndrome. And I think it's impressive to see all your research, but also how you're trying to translate these research into policies or, interacting with the government agencies and not just leaving the work all to NGOs or charities, but actually to see how, local governments or, Ministry of Health, Department of Public Health can actually benefit from your research all across Nigeria, Abuja, Lagos, but also beyond Nigeria to Ghana, Uganda, Malawi, Morocco, and so on and so forth. So thank you very much. There are a few questions we have from those following us online. I'm just going to read some out, and I'll put some in the chat so it's easy for you to see. How would you access, e-learning? Particularly, you talked about music, one of your field experience when you were in Nigeria, where a teacher would play music before going ahead to deliver, a session. So I just wanted to know how would e-learning tools or technology or clinical health technology or readiness in general, how can that be integrated into how we manage the healthcare and welfare of people with Down syndrome? Thank you.
Okay, thank you so much for that question. Okay, I would say, first of all, this cuts across Africa, like other countries as well. Stakeholders like the United Nations Convention on the Rights of People with Disability, they are really fighting for these people, and other policymakers, they're really fighting for them to make sure that they also experience the benefits of digital health. So I would say we need to make efforts as a continent to apply this in action. I don't know if I've answered your question.
Yes, I think that partly answers my question. So would this then translate into, say, investment in e-learning tools, or more like creating some digital platform where maybe an app on a tablet where they can interact with it? Or would it be better to instead work with caregivers who can make use of those devices or those tools, or create direct tools that can be used directly by the people?
Okay, yeah, basically it's better to create a tool that is used for the people, like I said, almost I kept saying throughout the discussion, we need to put them in the limelight. People with Down syndrome, we need to give them the opportunity. You can, like, for example, the app that was developed here in the UK, it was basically for the people with Down syndrome. And when I read through the article, I realized that majority of the adults have implemented it. So when they go to the shops, I saw some pictures where they checked to see if a particular meal was good for them or not. So they are being inclusive in the society. So inclusion in society is very, very important. Even though the caregivers are going to be asked questions, the main focus are the people. Are the people with Down syndrome. So they need to give the opportunity to also use apps as well. However, some people might feel people with Down syndrome might not really have access or might not really understand what it is to use smartphones. They can be taught, they can be tutored, and this should start from a very early, from childhood. Research has found that when education starts from childhood, it helps these people with Down syndrome. And also research has also found that they love mathematics. So all this needs to start from an early age, before they get to adulthood. Then with that, then they become used to it. So to answer your question correctly, it's better to get them involved. They are, I would say, they're the key stakeholders. They're the key stakeholders. Yeah. Yeah.
Thank you very much. Thank you very much. I mean, there's a lot we can unpick from that, because I would expect from experience and some of the things we talk about at the SDHPR on this forum is that some technological devices or solution can agitate some people living with some other condition. So maybe that's not necessarily the case with Down syndrome, but in some other cases, if you introduce something new for people who live with severe ADHD, for example, it might take a while in terms of adapting to the use of such, but it's very clear, and thank you very much, Ogochukwu.
Yeah. To add to that, I understand what you're saying. You see, that's why that's why we need to start from early, when they're still in their childhood, to kind of help them. And also, when it comes to technology, we also need to be wary of of fraudulent acts as well, because the digital age is like a two-edged sword. It has the good sides and the bad sides. So we need to also be mindful of that as well. However, it also has some good aspects of it. Yeah.
Thank you. Thank you very much, Ogochukwu. That's very, very, very clear. Daniel, you have a question. Can you go ahead, please?
All right. Thank you, Dr. Festus. Thank you, Ogochukwu, for that beautiful presentation. It was a very great one.
Thank you.
All right. Yeah, before I ask my question, fortunately for me, I have one of my students who is, of course, he has Down syndrome too. And I've been trying to see what to do differently with this boy. But with this presentation today, I think I can work better with him. And of course, I expect improvement in a couple of months or years and all that. Yes, let me go straight to my question. You've been able to give us the current status of Down syndrome responses and all that in Africa. But my question is this. What do you think the future prospects of technologies would be or are in improving health response generally in Africa? Yes, we have known the current status. However, we also need to know the future prospects of technology in managing Down syndrome and also improving health response generally in Africa, especially in relation to Down syndrome. Thank you.
Thank you so much for that interesting question. So the future prospects, I would say, first of all, job opportunities for people with Down syndrome. They can be employed. They are employable when they are being given the opportunity to go through school, to learn. Interestingly, one of my participants had completed his West African Senior Secondary certificate exam. He also did his JAM, which was interesting, and he knows how to drive. So out of the participants that I got data from, he's the only one that knows how to drive because his parents gave him the opportunity to explore things around him. So job opportunities will be a good prospect because it will also make them feel inclusive in the society. Also, I'm sorry, sorry, I have to keep referring back to my data because it's kind of interwoven. Majority of them also mentioned that they wanted jobs. So out of the data size, out of the sample size that I have, just 7 of them have jobs. Only 2 are paid. So future prospect is one, job opportunities, and also improvement in the healthcare setting for them as well. There'll be improvement, and also in the area of having like trained professionals in understanding their area of needs. For example, in the case of dementia, like I mentioned earlier, because most of the time they tend to it develops at the age of 40, then it also helps them concerning their oral health. Most of them also have issues when it comes to their dentition, their general dental health. It's also help improve that as well. And also for those that are in remote locations, with the aid of digital health, they won't feel left behind. They will feel they'll feel as if they are also part of the society as well.
Thank you.
I answered your questions.
Absolutely, I'm sure you did. Thank you very much for this excellent presentation. For those who are joining us, thank you for your time. And this will be, we'll just wrap up here because of our time. I've just shared, a link to some of Ogochukwu's publication on Down syndrome and public health in Nigeria. So please, you can have a look. We'll also have this on our websites and as well as on our Facebook social media platforms. I just want to recognize all who've joined us. So Kim Wang, thank you. Eda Khan, thank you. Osejobe, thank you. We also have Jane. I think that's Ogochukwu's, one of Ogochukwu's supervisors. So thank you very much for joining us. It's a privilege to have you. I don't know if you want to say something, but thank you very much.
I just want to say well done. I think it's so important to recognize these marginalized voices wherever we're doing research. And it's been a pleasure working with Ogochukwu.
Thank you. Thank you very
so
much, Jane.
Jay. Thank you. I've learned so much from you as well. Thank you.
Thank you. We'll also promote those publications just in case somebody wants to have a look. And if you can't access any of those publications, please feel free to send us a mail. We'll be able to, I think they're open access anyway, but if you can't access it, just let us know or let Ogochukwu know. We'll also have more, further roundtables in the new year, and mini conferences happening, all across Africa. We're covering different kind of health issues and, improving well-being using digital technology tools. So please stay in touch, and thank you very much, everyone. Have a wonderful rest of your evening. Thank you. Thank you, Ogochukwu.
Thank you, everyone. Thank you.
Thank you. And if you'd like a copy of the slides as well, just let us know via our email. Thank you very much, everyone.
Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you.
Bye. Thank you. Thank you, everyone.